welcome everybody to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I got a fun behavior one for you today. I am here with vet tech behavior specialist Tabitha Kucera, and we are talking about lunging dogs. We're talking about high FAS score dogs that are scary to work with, and pet owners who are just like, get a muzzle on him and let's get this done. So anyway, I got a question from our mailbag that I put to Tabitha. She kind of runs with it. Anyway, this is a fun episode. If you like behavior, if you like animal handling, if you happen to work with animals, this is a good episode. Lots of reasons to listen to this episode. Guys, I hope you'll enjoy it. Tabitha is so much fun. She's super passionate. I really always just enjoy her energy and her enthusiasm for animal handling and animal behavior. Guys, let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome back to the podcast, Tabitha Kucera. How are you?
Good. Thank you so much for having me on. It's always a blast to talk to you.
Well, I have a wonderful time talking to you, and the last time you were on, you made quite a stir. I got many comments about the episode. It was very, very popular. The YouTube version got a lot of views, and also just people were like, this is really great. The reason that you were on, we were talking generally about animal handling, and actually, I think we were talking about something else. I think I had a case to ask you about, and then you kind of like went off on how important animal handling is and why everybody should be paying a lot more attention to it, and how it's a beautiful skill that should be developed and should have its own specialty. And I was inspired, and and other people were too, apparently. So I think you kind of started a revolution, I think, on the Cone of Shame podcast. And to that end, anyway, first of all, it's wonderful to have you back to that end. And second of all, I got asked another question, and so it came up, and it was put forward as this would be a great podcast episode. And as soon as I saw it, I knew that I wanted to bring you back on and ask you this question and have you work through it with me. Are you ready?
Let's go.
Well, actually, no, I should say, okay, you are an RVT, you are a VTS in behavior, you are a huge advocate and champion and expert in and around animal handling. You are the force behind Chirrups and Chatter, which is your own business where people can sort of find you online. And you are an excellent lecturer and teacher, and you work with vet practices and shelters around animal behavior, especially animal handling. And so you do all of these things. So anyway, that's who you are. Here's what I got for you. All right, so the official question that came in is this. What is your recommendation for the lunging giant breeds that are attempting to bite upon entrance to the room when an owner refuses to muzzle train, use oral medication prior to exams or injectables at the visit? I have an owner that just wants us to tie them to a table, give vaccines in the hand-in, and refuses to pay for the exam because we couldn't do an exam. My desire is to refuse to see them, but how can I educate the owner? And so, there's a lot of things here. I don't know, how do you want to approach this? Do you want to talk about the lunging giant breeds coming in? Do you want to talk about your feelings around the get it done culture? Do you want to talk about the communication part with the pet owner?
We could touch on a little bit of everything, right? We only have so much time. First off, thank you for sharing that concern. It's a tough spot to be in to deal with lots of different challenging situations that were thrown in vet med, including fear-based behaviors. Because again, that aggression is in most cases due to fear, stress, pain, which we tend to see a lot of patients who have that. So immediately my brain goes to context, right?
Yep.
What can we, because for example, let's say that dog is lunging when they enter. That tells me like, hey, we're going to just avoid the lobby altogether. Did they see a dog and go over thresholds? Because that could have easily been preventable. Or when you walked in, he started barking. Then could we start to utilize some considerate approach techniques to reduce fear, anxiety, and stress? So it's not always, because again, like you said, there's a lot of context, but we need to look at the whole picture. Because I work with lots of animals who enter the clinic with an FAS of 4 or 3, and I have it either managed at 3 or reduced because of my environmental modifications, my approach. And also, I think communication plays a big part. And also, I love a PVP, everybody. Hot take. I love a PVP, but I do not love them on their own.
Let's define some terms.
Oh, very cool. Yes.
So So FAS, and then you said an FAS 3 to 4. What does that mean for people who are not familiar with fear anxiety scores?
I'm referring to the fear-free body language score just because that's a one that people are more familiar with. And FAS 5 is essentially, if we were to do colors, right? Red, this animal is so fearful, they're over threshold, they're more likely to exhibit fear-based aggression. And at this point, their physical well-being is compromised. Like we're seeing delayed wound healing and a lot, not just emotional distress, but actual physical changes, physiological changes. FAS 4 is, again, kind of, FAS 3 is, we're starting to see a lot of displacement behavior showing some conflict. Yeah. FAS 4 tends to be that frozen in fear cat or dog, right?
Gotcha. Okay.
And then as far as PVP, that's a pre-visit pharmaceutical, or as she mentioned in the question, like some medications that they can give prior to the visit to help with some of that anxiety.
And then you talked about a considerate approach. Tell me what you mean when you say we can work on a considerate approach.
So, for example, I talked a lot about how a lot of us aren't set up for success. The way I was taught to approach animals was not considerate, and in many cases, escalated fear and stress. Yes, exactly.
Come here. Good. Let me scratch your face.
Reaching out towards them, giving them a treat with your hand, and this poor animal is like, "What? I have conflict. Even if I take the treat, we should be tossing treats to prevent some of that motivational conflict. Like, I really want the treat, but I really am afraid of that person versus let's just toss it." And so using it, like, for example, if I walk into a room, like if I have this dog in the future, I'm going to do more things proactively. Like we're going to schedule them at a quieter time. We're going to take them through a side door. I might just do their exam in the backyard, like outside. Yeah. Because that might completely decrease FAS overall. But let's say the CSR notices the dog, because it's a whole team effort, that dog is going to go into a room immediately. And if we don't have a room, we're going to walk them out of the lobby if there's a lot of stimuli and triggers in the lobby to the side of the hospital. Hey, if you are exposed to something you're afraid of, the best thing we could do in the moment is increase distance.
Yeah, get out of here.
So that's the one thing I would do. Secondly, when I'm entering that room, and to be fair, I do this with most animals, I am going to approach, usually as a technician, right? I come in first to obtain that history. I'm going to use a side approach. I am not going to immediately ever interact with the dog or reach over the dog to say hello to the client. I'm going to come in, stand near the computer by the door, and assess the animal's body language. If this dog is, as she mentioned, lunging forward, I'm going to maybe toss a few treats, like with not even my hand, my wrist. Like I'm very specific with all of these things. And then let's say he bends down to eat a treat. That gives me data.
Jump on him.
I'm sorry, what?
Yeah, no, okay. Said you're going to jump on him.
Yeah, so that gives me data. So let's say he can take a break to eat a treat. Because just because they eat a treat doesn't mean they're relaxed, obviously.
Right, of course.
But then I could be like, oh, I'm going to give mom a snuffle mat or a Kong to kind of positively distract the dog and allow him to sniff and lick, which is a self-soothing behavior and can cause some
oh, I like it.
Breathing. And then I obtain my history. And in some cases, that dog's FAS decreases by 1 or 2 points just with that approach. Because what I was taught to do is enter, like you said, all this high-pitched, especially if you're fearful, stimuli with humans and animals, if you're fearful, makes everything more intense. I might say, I might tell the caregiver, which we should communicate with the caregiver, hey, can you just keep a hand on his leash? I can understand he's a little fearful. And I might even just toss a few treats around the room and just say, I'm going to pop in a minute or two. Can you allow him to explore a little bit and then grab his leash and give him this near you? Because also sometimes I don't want them to drop the leash, obviously, with me in the room. But here, take a minute. I'll be right back. Let's let him breathe and sniff the room a bit and then maybe focus on this enrichment activity. And then ideally I avoid knocking, but in this context, I may knock and I'll say, that's a cue for you to just grab his leash and then we can continue. And in many cases, that can kind of reduce that anxiety or at least manage it. So there's a lot of things because I work with high FAS patients and I always tell people there are so many tools as far as critical thinking, handling skills that we could do to either manage, at least not make it worse, or prevent fear, anxiety, and stress. Because sometimes I think, I understand, I can't know for sure because it's just a quick question, but I understand how a lot of us feel stuck. Like, we're like, this dog's lunging, he's exhibiting fear aggressive behaviors. I'm familiar with PVPs and muzzle training, but I don't know any other tools. Yeah. And that is a challenge, but also I can understand where that caregiver, and this is where that communication point comes in, why that caregiver may misunderstand, or we may upset them, not maliciously. Like, for example, I've worked with some amazing practices, and, you know, I'll do some consulting and education and like hang out with them for the day. And I've met so many amazing veterinary professionals who they'll have the dog, working with the dog, and whether it's on arrival or like third ways into the appointment, they'll be like, he was really scared, we're going to give you PVPs. And I'm like, whoa, what? I'm like, you have to understand from the client's perspective, this is coming out of nowhere.
Yeah.
And I understand it is helpful, like that professional means well, but I'm a huge fan of communication, as in I am communicating what that animal is feeling throughout the entire visit. Yeah. And I'm not going to say, because you're scared isn't a horrible thing to say, but I'm not going to be like, oh, he's really scared. I'm going to say, I get really nervous at the doctor too, and I understand he's not feeling well today, which also adds to some of his discomfort. We're here to help him make him feel better, but I see that his ears are back. So I'm not just like, your dog's scared. I'm using a lot of analogies, and also to help real talk. It's a problem, but there's a lot of stigma with medication for anxiety with humans and animals. And sometimes if we're just, again, kind of like, that person means well, but they're like, we have to stop what we're doing. Your dog's scared. Here's meds. And I'm like, I can understand why that client may get upset or become I'm not saying it's right, but become defensive, because they take that, even though you didn't mean it that way, they take that as, where the hell did this come from? Like, what? Because they don't know how to read body language well. Like, most of us haven't been taught those skills. So, and also it's hard for them not to take it personal. Like, my dog, you didn't say the dog's bad, right? But you have to realize muzzles, which hence the unicorn in the background with the muzzle. I'm working to end stigmas, because muzzles are great when they're not abused, right? I'm not going to sit on a dog in a corner and throw a muzzle on, which is what I was taught to do. So we have to recognize there's some stigmas in society that we have to be proactive about and conscious of when we're discussing some of these things.
Talk to me about the idea that Buffy, he's probably going to be better away from mom. I'm sure you hear that a lot. That seems to be just something that I hear a lot. What is your idea around that? I mean, is that a fairy tale? Is that something that people they make that up? Is it helpful? Is that a good way to try to, I think people are sort of trying to make the owners feel better and say, oh no, this barking and lunging when he's away from you, it's because he's protective of you. I think that language is about trying to make the pet owner not feel embarrassed, maybe. But I don't know. What is your philosophy on separating pets from their owners to try to reduce FAS?
That is a really great point, because you're right. I do hear that a lot, whether it's from a caregiver that I'm working with away, like as a behavior consultant, or in practice. And I'll be honest, I'll tell the colleague, like, I understand, I say that's a common misconception. 99% of the time, as someone that works with high FAS patients, the animals do not do better. And also, how are we defining better, right?
Right.
So a lot of the times, like, for example, let's say I have a very high FAS dog, and whether it's my colleague or the caregiver, because of course I'm not there all the time if the caregiver is communicating this to me, but they're like, oh, they took him in the back. They took him in the back and they said he did fine, that word fine. And then they bring him back. And I'm like, I'm going to be honest with you. It may not be the case, and I'm sure it's not malicious. And then I have a whole handling, we're not set up for success spiel that I give a lot. And I'm like, it's likely that the dog was frozen in fear, and I understand that they could still do their procedures, but real talk, I commonly see people misinterpret frozen in fear as chill.
Yeah. So
I think that's more likely. And I think the other thing is, some of these conversations can be challenging. The more you practice, the better. The cool thing about vet med, I love talking and communication and people, but even if you don't, you get so much practice all the time. So we need to utilize that and be like, for example, I'll never forget this. It's a sad thing. It makes me upset. But I was a baby tech, and I will never forget this. There was a pug, and he was there for a nail trim. Poor guy. And he went back to treatment instead of a exam room with the caregiver. And this dog, like, barely could breathe. Like, he became so stressed. It was like, I'm not talking about, because psychological, emotional trauma is serious, even mildly. This dog, like, had trouble breathing, and I will never forget. And I'm sure the colleague meant well, brought the dog back and said he did great. And to me, that's like not telling a client their animal has a heart murmur. Like, it is dark.
Yeah.
Because there's nothing wrong. I'm not ashamed of fear. Fear and anxiety exists. Pain exists, especially at the clinic. Why are we like, which is also where I think some of these misconceptions that caregivers have come from, because we have to be, I had a client, again, this was a baby tech me, so I would probably even be better now, because we get better as know better, do better. But even as a younger tech where I was a little aware of this, had some handling skills, I remember this caregiver came in. This hardly happens, which also tells me I'm probably getting better at that. But she's like, just hold down the dog and get it done. Yeah. And I could understand how upsetting that is to a lot of you out there, and how upsetting it was to this person that asked that question. But we have normalized, I'm super fun, Andy. We have normalized severe fear and trauma in vet med. You have to realize I'm in vet tech schools, in vet schools, we are still taught restraint. Hold them down. That's what, if that caregiver's learning history is, for the last 15 years, they just sat on and got it done. They didn't know they trust us. We should. Right. So we have to, I know it's hard, but we have to consider societally, we're getting better, know better, do better. That's why we call it practicing vet med, which I love. We're always improving, but we have to have some empathy and realize, like, the client doesn't think that this dog is going to be psychologically. Yeah. Because this dog has, like, I work with a practice that had a previous owner, and they were purchased, and the previous owner utilized some pretty rough, outdated handling techniques. And there was a learning curve for some of those caregivers to understand, like, but also those caregivers didn't recognize, like, dude, sitting on the dog is like inhumane. Like, this is an animal welfare issue, because that's what's been done to their dog for 5 to 10 years. So that's where I think that empathy and communication, and I do think being transparent and communicating the body language the animal's feeling, so then it's not coming out of the blue. It's not just like, and also, we can't do this. Here's this med, come back, and nothing else changes, which is not how, fun fact, not how PVPs work. Right. Not that I ever see them used like that. So I can also understand from the client, because I may say, like, wants versus needs, like this nail trim. In most cases, it's a want, like this animal, obviously, if their nails are growing into them and stuff. Yeah. But I'm going to not just say, come back, do this. I'm going to say, this is our plan. This is our long-term plan. We're going to I can help you file his nails at home. Like, I'm giving multiple solutions and support. I'm not just saying, here's these meds, come back. Yeah. And also, I don't think we have to address, I've talked to a lot of caregivers who have negative associations with, I'm sure you have too, Andy, as a vet, who have negative associations with some of these medications. They're like, my brother was on gabapentin. Yeah. And then they share this story that is would not look like that in your dog. But also, I'm so thankful that they felt comfortable enough to, because I might say, oh, are you familiar with these drugs? Yeah. Have you ever, and then they start to tell me some of these stories, like trazodone. A lot of these drugs are used in humans, and they have these really traumatic histories with these drugs. So I can unpack those myths with them, or how, like, not the myth, like the things they're concerned about, and address the side effects and say what's normal, and say, we're going to do this in the future. We're going to have you, there's a lot in the lobby. I totally get it. He doesn't feel good, and then he sees this dog. We're going to have you come at a quieter time. So I'm providing multiple solutions, but I'm also showing my value. Yeah. Because all of you are amazing, by letting them know, like, this is what we're going to do. So I have found a lot, and again, I think the biggest thing is addressing those stigmas, recognizing that, unfortunately, a lot of us have normalized, like, less than 15 years ago, I was taught to sit on a dog. Like, it's a bummer, but it's true. or hold a leash through a door. Oh my goodness gracious. Like, we can't get into that, but I can give you 15 other things to do instead. But that's where handling plans and handling skills come in, which a lot of us aren't really set up with. So it can be really challenging even when we want to help these caregivers because we don't know what to tell them.
So I really like this a lot. I think your approach around empathy for the pet owner that doesn't understand, who's like, oh, we've always just sat on them and got it done. I think you make a good point that we have trained those people, or those people have at least been trained. If it wasn't by us, then it was by someone else. I think that empathy is the first step in actually making a connection. And then what I'm sort of hearing you say is sort of try to meet these people where they are, talk to them about what the plan is and why the plan is that way. Do you ever see people who continue to push back, Tabitha? Like there's people who are just like, no, he's fine. Do you ever get to that point where you've made your presentation and talked to them and there's people who just for whatever reason are not on board with sort of rethinking the stigma?
There have been a few situations, like the practice that I work at, right? The staff is amazing. Again, very skilled handlers, great at communication. But there have been, and I'm sure part of that has to do with some of that change in ownership. But There have been a few clients where they were just not a good fit, and that's okay, right? Like, it's okay. Now, is it that common? No. But as a behavior consultant in 10 years, I've had to, like, not work with, like, less than 5 people.
Yeah,
but
that's good.
Those things
do
happen. Like,
I think you put your finger right on it. I have this idea, and I can't prove this. I feel like we came from this time in the past where I think a lot of vets felt like you had to take whatever the pet owners dished out.
Yeah.
And when I sort of came up and I was out talking to people, I think I was kind of earlier on in the idea of going, I'm not taking abuse from pet owners. I'm going to be treated with respect and I'm going to do a good job. And I think I have to hold up my end and listen to them and do the absolute best I can. But I'm not going to be abused. And I think some people really needed to hear that. And now in the last, I think over the pandemic, I think people's behaviors towards service workers has gone down, which I do think is bad. So I do think there's a problem here. But I wonder a little bit in response, have we gotten too fast to say, oh, well, you're not a fit here. You're not a fit for us. And I think it very much varies with the practice.
Of course.
I really do think that people are good, innately good. And if you can be empathetic and you can be patient, that doesn't mean you have to get walked on. But I do think that we can meet a lot of people where they are and sort of bring them along to where they need to be. But I do agree with you. I think that there are some people, but I think they're few and far between when you say,
they're not common.
This is not a good fit.
And if you're seeing that again, how I mentioned, if you're seeing a lot of bites and scratches, we should look at that as data. If we're seeing a lot of that, that's data that we can maybe help the staff feel more comfortable having these challenging, because these are hard. And if you get no practice except for when you are thrown in it, that's like me doing a handling workshop and being like, FAS 5 dog, go. That's a horrible teacher. That's bad.
It's a terrible workshop. It's like, oh, yeah. It's interesting that you say this. So I had Dr. Nathan Peterson. He's an emergency critical care specialist at Cornell on the podcast recently. And he was talking about research that he had done around medical futility and the impact that it has on technicians. And basically what he talked about was medical futility is the belief like we're doing stuff and this is not actually helping. It's not going to fix this animal. We are doing stuff for the sake of doing it. And he talked about how that really hits technicians very hard. And part of it was around sort of communication of what are we doing? Where's the plan? It was funny. He said that when you have cases around medical futility, it's actually unfortunately fairly rare for the veterinarians to communicate clearly with the technicians about what are we doing? What is the plan? How does this work? And make sure everybody feels sort of supported. And so I thought that was really interesting. But, he also talked very much about the impact on technicians seems to be greater, probably because of what they perceive as a lack of agency, right? So if you're the doctor, you can be like, I'm not doing this. And if you're the technician, you might not feel like you have that sort of that power. And so now you can end up in these positions where you have a terrified pet, you have an FAS pet.
Unsafe situation.
You have exactly right. Yeah. You have an unsafe situation. You have a pet owner that's maybe not trying to hear you. And if you don't feel supported by your doctors or by your clinic, I think that can be a really, really challenging, both for a safety standpoint, but also just from an emotional standpoint, from a burnout standpoint, from things like that. I think that these conversations around what are we doing with these pets and how are we controlling fear, stress, anxiety, I think that they're a patient handling issue. I think they're a medical quality issue. And I also think that they're a burnout wellness issue.
I definitely agree. I think so. As far as my handling plan, because, I have things that are involved in that. And the first thing is communication, which means the fact that I used to go in a room with a vet, and both of us weren't doing this. And I would give the history and we would go in and we didn't talk about the order of procedures. We didn't talk about I was like, what the hell this is mental. Like, what? And it wasn't either of us it's just, that was, like you said, it was a normal thing to not communicate. Like, I liked the vets I worked with, but we discussed that, our plan. And I talked to the caregiver about it. Our plan today is to start with an exam, and then, because we're just doing needs versus wants. Like, some of us already do that and don't realize it, but I'm very clear where I was like, we're going to start with an exam today and then blood work, because I know we're really concerned. We want to check out blah, 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 these values or whatever. And then plus or minus vaccines, plus or minus nail trim. We're going to see. And I start the appointment that way. So that's the other thing. When we stop, it's been a conversation and the vet is also there. The CSRs I might say, hey, I'm just going to have the CSR come in the room to check you out. So it literally, that communication aspect is huge, because I'll be honest, I've been that tech where there was a high FAS patient and they were rescheduled as a tech appointment, which I love being utilized, heck yes, with a PVP on board. And there wasn't a trial done, and it actually caused increased agitation.
Oh, so you got that? Yeah, the hyperagitation, the paradoxical excitement. Yeah, that's a fun one.
And again, literally all that was done, was PVP come back, and I'm like, no. First off, I'll be honest, I felt helpless. I'm like, this is raw. You set me up to fail, dude. You put me in a really unsafe situation, and now I have to tell this client who already came back.
Right. I'm sorry.
We can't do this.
Worse than last time.
And that was
because we didn't do a trial.
That was our bad.
Yeah.
Real talk. There was a lot of misses there. So a big thing I like to do with a lot of the clinics I work with, we also build this kind of in to our culture. So something I actually wrote a few down, but we include in our policies sedation. So these are just two examples. Our clinic is committed to reducing fear, anxiety, and discomfort. Sedation is utilized for any procedure that may cause distress, ensuring your pet's emotional and physical comfort. To prioritize your pet's comfort and minimize stress, our clinic policy is that all patients be sedated for procedures that may cause physical discomfort or emotional distress. So it's also not this weird, because you have to realize sedation is scary from a care. For me, I love it.
Oh, sure.
But from a client's perspective, it's a lot. And also, unfortunately, I have worked with a lot of clients who it's really hard to talk about, but who in the past, the dog was sedated, but they were severely pushed over threshold. Their leash was put through a door and they were essentially choked to get sedated. And that's something that I've seen done as a baby tech, and they were doing the best with what they knew. But so when clients see me sedate their dog, they're sobbing, because they're like, I did not know it could look like that. It took 15 seconds. Everything was really, because that handling plan. So we also don't know, we can't know everyone's history. You can't get their life stories, even though we love talking. But we have to consider, if you notice an escalation in their body, that humans' FAS go up when you say the word sedation, that gives me data to ask more open-ended questions about what that looks like. But making it when I say policy in your hospital, it's a culture. It's not just, you're that behavior tech that is more skilled at handling because you've gone out of your way outside of the hospital to learn. The rest of the staff has not done that. And I haven't been allowed, or not me, I haven't been allowed to teach the staff, right? And you're like, I feel stuck. And because the vet or another staff member may disagree that we have to stop or sit on them or something else. And then there's a lot of, I'm going to be honest, that contributed a lot to severe mental anguish for me. And that could have easily been resolved. Or even something I commonly see is a staff member who is definitely not equipped, and it's obvious that they are uncomfortable based on their body language. That they are not comfortable handling this animal, and it's ignored. And then they go, that's not going to go well for anybody. The animal's the person doesn't have the skill set. They're already severely stressed. We're throwing them in a situation where they are putting the animal at risk. We're putting them at risk. We're creating long-term trauma for that staff member.
Yeah.
like we have to advocate. And also I understand how a tech or a vet might be uncomfortable saying, I'm not comfortable handling that animal. And that's where I come in, where I'm like, I need to help you be more confident. But it is challenging because some of these environments are not as psychologically safe as same thing in human hospitals. Lots of accidents get done because the nurses are punished for saying that's the wrong leg to cut off. And there's actual research to support this in human medicine. Like, wrong legs are cut off because the nurse knows it's wrong, but she'll get fired if she says it's rough, man. Yeah.
Well, yeah. Tabitha, thanks so much for being here today and talking through this with me. I really appreciate it. Where can people find you online? Where can they learn more from you?
You can find more about me at chirpsandchatter.com. And then I'm on all the lovely socials. So Behavior Vet Tech on TikTok and at Chirps and Chatter on Blue Sky, Facebook, all of them, Instagram, LinkedIn, all that lovely stuff. But thank you so much for having me on. And thank you to whoever was brave enough to put out that awesome question, because I wish there's an easy answer, but it's complex for sure.
Well, definitely. Well, thanks for talking through it with me. Guys, we'll put links to everything in the show notes. Thanks for tuning in, everybody. Take care of yourselves, gang. We'll talk to you later. And that's what we got. Guys, thanks for being here. Thanks to Tabitha for being here and sharing her knowledge and her passion for her work. Gang, I hope you got something out of it. If you did, feel free to share it with your friends. They would not get something out of it. Share it with your mom. She wants to know what you do for a living. And this is a great episode because it'll make your mom think that your work is cool and kind of dangerous, but you can be like, no, I'm a good animal handler and it's not dangerous for me, Mom, relax. And your mom will be like, so proud. And that's what we're all looking for. Anyway, that's all I got. I'll see you guys later on. Bye.